Welcome to Digital Democracy on Tap. I'm Sarah Jane Crespo. As we navigate best practices to limit the spread of COVID-19 and manage social and health concerns of children and educators, many questions about how and when to return to school linger. Tonight, we'll discuss Wichita's plan for returning to the classroom in light of national and state decisions. Send your comments and questions, and we'll get to as many of them as we can. On our panel this evening is Kimber, Director of Health, Homebound, and 504 Services, and President of the Kansas School Nurses Organization, Dr. Rick Muma, Wichita State Executive Vice President and Provost, Dr. Alicia Thompson, Superintendent of Wichita Public Schools, Dr. Paul Teran, Pediatric Hospitalist with KU Wichita, and Stephan Bisaha, Education Reporter at KMUW. Thank you all so much for being here. Let's begin with Governor Kelly's recent decisions about returning to school in the fall. Stephan, can you fill us in on what's happening and what still needs to be decided?
Yeah, there were two main executive orders that she announced yesterday. The first one is regarding to a lot of best practices that are going to be required. One of the main ones being daily temperature checks. So anytime someone enters the building, be it a student, be it a teacher, any staff members, they will have to get their temperature checked. That's a bit of a challenge for schools that were not expecting that to be required. It was in the guidelines that the State Board of Ed released last week. But those are just guidelines. Nothing they sent out was required. They did say it's best practice to have a daily temperature check in the 1,000+ pages that they put out. So a lot for schools to still go through and decide on what they're going to do. But this means they will have to check everyone's temperature upon entering. That also means they need to get a lot of these thermometers, no contact thermometers, or other options such as like different ones, just cameras that you just see the person's body heat as they come through. A lot of decisions to make, and also not that much time to actually get those thermometers, get that equipment, which goes into the other order from Governor Laura Kelly, which is she wants schools to be delayed by 3 weeks to open after Labor Day. Now, this she can't just do. The other order, fine for her to just do on her own. For this, she needs approval from the State Board of Education for it to become official. They're going to be voting tomorrow. They're meeting at 10 a.m. So sometime tomorrow we'll have an answer whether that will or will not be happening. Again, the main reason she says she wants to do that, partly to numbers have been rising in Kansas. She wants to give more time for hopefully that trend to start going in the opposite direction. The other side of it, again, is to give schools more time to get supplies. I've been chatting with a lot of school districts. They feel pretty good about where they're at with a lot of their supplies, things like hand sanitizers and masks, but every business that's been reopening needs these supplies. Every school district needs them. Everyone in the country needs them. So there are some challenges getting them, especially when it comes to these thermometers, because it's such a last minute thing that they now have to get. Having an extra 3 weeks to get it would be a big help. But that also means 3 weeks unless there's some sort of waiver by the state board, 3 weeks that the schools have to find somewhere else to fill that instruction time.
Mm. Well, let's go to you, Dr. Thompson. If the Board of Education approves Kelly's plan tomorrow, what does this mean for USD 259? How will you cope with these requirements?
Well, we are already working towards that plan. A lot of the things that she had in her executive order, such as the social distancing, the hand washing and the sanitizing, the masks, all of those things were in place and in the works for us from the very beginning. We were kind of teeter-tottering on the ages of the smaller students with the masks, but that answered our question, so we're ready to rock and roll there. We were Stephan talked about, that temperature taking of all of the students and the staff members is going to be something we're really going to have to work through. We're talking about 50,000 students, and you're talking about 9,000 employees daily taking temperatures. So we'll really have to process that and making sure that we have enough equipment and making sure that we have the personnel, because it's not just about that, it's about the personnel also that is going to be needed to accomplish that particular task.
There need to be arms holding the the thermometers
Yes.
have more arms.
So we will really need to problem solve that to get that order, that particular mandate in place. But the other piece, as it relates to the start of school, we'll just make those adjustments, whatever that adjustment may be, and then we'll have to work on calendars, as you would know that. And so we would need to adjust our calendar of our start time, and then also looking at our staff, classified and certified staff, to determine how we adjust to meet the contractual obligations that we already have in place with our faculty.
I'd like to get more into the logistics and funding pieces of this whole puzzle. But first, I'd like to go to Dr. Rick Muma to talk about, at the university level, to what degree are you able to make, the university is able to make its own decisions about returning to school, doing in-person or online? Can you kind of give us an update on WSU's plan and how much the Board of Regents plays into that?
Thank you for giving me the opportunity to speak to you about our plans today. And like Dr. Thompson said, we've been working on our plans since the beginning of May. We have 70 plus people, faculty, staff, and students working on implementing a safe campus reopening. So while K through 12 might have some other issues to work through, some nuances that Dr. Thompson has talked about, we have a little bit more flexibility in terms of how we move back to campus. The Board of Regents does play a little bit of oversight. They don't vote on when we start or how we start, and we do notify them. For example, this fall, we're planning to have the same calendar. We're going to start school on the 17th. From our experience in the spring and the summer, where a lot of our curriculum was moved to remote formats, we're going to continue to do that, but allow some in-person abilities to evaluate students, things that are not easily done online, like testing and performances and those sorts of things. But we're still moving forward. We are going to cease all of our in-person activities the Friday before Thanksgiving. And so after that point, through Thanksgiving and obviously the Christmas break, those activities, which just happens to be only 4 instructional days plus finals, that will be delivered remote. And we won't start back until the spring, until February 1st. But we're going to have the same kind of things that Dr. Tompkins talked about, requiring masks, frequent hand washing, physical distancing in the classroom, and other kinds of activities that are recommended by state and local authorities. So,
Dr. Teran, I'd like to move to you here quickly to talk about, I mean, it seems like we're learning more about this virus daily. I mean, we definitely are. And how it affects children is kind of this mysterious piece of that. Can you give us an update on what we know about how children carry it, spread it, and suffer from COVID-19?
Yes, and when we talk about the data on COVID-19, we have to be humble and realize that we get hopefully better information week to week. So from the standpoint of pediatricians, since probably a couple months ago, we started realizing that young children, especially less than 10, we're going to see less symptomatic infections in those kids. And therefore, we see less kind of case rates in kids. And part of that is due to the kind of physiology of the child, but also how the virus kind of acts and the behaviors of those young kids. Then when we get into that kind of post-puberty or teenagers, the 10 to 19, we're seeing that they behave more like adults, and they, although still don't get as sick from COVID-19 most of the time, they can transmit it easier than the younger kids. So this is information that we're kind of working through, and when it comes to how you infect somebody else, of course we can all realize that it's reasonable to think that when you are more symptomatic, you likely have a higher viral load, and then you're going to have more of a cough, more mucus, more of chance to spread it kind of at a higher rate to those in the community, those around you, your household contacts.
Plus, those kids are so small, they're shorter. They're not coughing right on your face.
Yeah. So especially in those kids less than 10 who are maybe aren't coughing right on your face, or they a lot of times they're asymptomatic. So hopefully they aren't spreading as much as the symptomatic kids. So but on the other hand, when you are asymptomatic, the risk is you spreading it without knowing it because you're doing kind of normal activities. There's a lot we're still wrapping our head around, but I think we're thankful here in Wichita that kids aren't getting severely sick, but we do have these rising numbers that we have to pay really close attention to.
Kimber, what is your biggest concern for students when it comes to the return to the classroom? Can you pick just one?
Okay, my biggest concern is really making sure that parents and staff, I know where you asked me about kids, but that if we're sick, stay home and don't come to school and don't come to work. I give you a laundry list of my concerns. Right there, I feel like that's so important. Middle people have a strong work ethic, and we believe in education, and we've got kids that love to come to school. So I just feel like we have got to stay home if we are sick, or if we have been identified as a close contact, or if we live in the home where someone has been confirmed a positive COVID case. You need to follow the directives of the health department and quarantine at home.
Will there
positive to isolate?
Will there be room made for that? Is that part of the system so far? Maybe Dr. Thompson wants to jump in here at this point as well. How are we making room for that?
Okay, well, home quarantine is different. If they're sick for 14 days, we're not going to quarantine them at school. I just want to clarify that.
Right.
Someone does make it to work or school. Okay. Sometimes you really are like, oh, I just maybe didn't sleep well last night, but you went to work and then you got there and you started having some symptoms or you felt feverish. Then at that point, our teaching for all staff is going to be to immediately, we've got a flow chart. They contact their supervisor, they'll contact HR. If they feel like they need to be assessed, the nurse can assess them. Otherwise, they need to go home from work. For students, teachers, once they come back, they're going to be given a checklist of if students are complaining of any of these things, any of these symptoms, or not feeling well. We will have a plan in place of how they're going to contact the nurse or the office, whoever's covering the area, and then we will have them come. They'll be wearing a mask anyway. If they wouldn't have had to wear a mask, we would put one on them. But since they will be wearing masks, then we will have them come to the isolation room area, not the normal health room where we're managing chronic healthcare conditions and diabetic care and asthma and injuries and other illnesses. So we will have a separate area. An important note I would like to make for parents is to make sure you have all of your contact information up to date when you enroll, and keep it up to date so that we can contact you if we do need you to pick up your child, because we're going to need kiddos to get picked up as soon as possible if they have COVID-like symptoms, and especially if they're running a fever, and we will keep them in that area, with masks on, and keep them isolated at that point till they can be picked up.
Dr. Thompson, do you think this will require a larger stable of substitute teachers? If someone has symptoms, how will that be dealt with if, all of these teachers are afraid that they've just been exposed, and it might be a large group at one time? How is that part of the plan?
Yeah, that's pretty critical for us to be able to get our teachers back in at some point, to be able to have those conversations. what the State Department of Ed has done is they have created the instructional models where you have bands of teaching that happens. So you may have a band of teachers that are teaching K through 1 or 2 and 3 or 4 and 5 in elementary. That's an example. And then that way, if someone within that band needs to leave, that we do have substitutes. Let me set that straight first. We have plenty of substitutes, and we've been in communication with them from the very beginning to say, how many of you are going to be willing to come back if we have, an outbreak? Are you willing to come, to replace a teacher? And we have hundreds of them that are willing to do that. So we don't really see that we have an issue as it relates to the number of folks that are willing to come back. But we do have a plan where teachers can fill in and out according to the bands that they are going to be taught how to use in this model that we have for instruction. So we have two plans. We have our regular subs, but we also have a plan for that. And we also have paraprofessionals in our building as well that will also be used to be able to support absenteeism as long as they're being supervised within that band to support students as they're doing those instructional models. So we have a plan in place to pretty much have the support that we need as we have outbreaks. Now, of course, if there becomes a major outbreak in a particular building, we will work with health officials to determine, what type of shutdown would occur in a specific building. But if it's one or two in and out like that, we would be able to support that.
Maybe the children elementary, well, I guess maybe all of them might not be with one teacher for this fall semester. They might, it might be that they kind of roll between teachers. Is that what this, I'm trying to imagine what this, the bands.
The teachers would be not, the students would not be rolling. The adults would be transitioning from space to space. And the students would stay in cohorts or little pods, I guess is what we would call them. So what you will have is if there's classrooms that are able to social distance, because again, we have 3 different models. So some students will be out of the in-school learning. They may be in my school remote. So we'll have students that are in that particular area. Then we have a virtual school. So there are a lot of families who will choose that option. So because we have choices, we will be able to spread our students out through the choices that are made available. Our high schools are another piece where, again, we will put our kids in pods. Teachers will be moving. So you may have, I'm just giving an example of what could happen. You may have a social studies teacher and let's say not necessarily a science teacher, but a math and a science teacher may work together. So those students in 6th grade teams or 7th grade teams or 8th grade teams would stay together in those pods, and those teachers would co-teach together with the special projects with math and science. So students would stay in those pods and in those classrooms for a couple of hours. Then we would have alternate, schedulings for kids to transition from different rooms. They will be staggered, so we wouldn't have the bell rings and then everybody just runs out, into the hallway. And then, of course, we have arrows to say we're moving in this direction in this hallway, in this direction we'll be moving in this direction. So there will be lots of order, lots of signage, lots of organization that will take place so that there is the social distancing is there, as well as the opportunities to keep kids together in specific pods and not just moving around the building as we currently do, as we did last year.
I have a bunch of questions coming in here. I'd like to get to a few of these before we continue. So Rebecca emailed us and asked, how will lunchtime be organized so that the risk of spread will be mitigated? And will teachers be tested for COVID-19 more frequently, similar to the way medical staff and frontline workers are?
Okay, I guess I'll take lunch and then I'll let Kimber or Dr. Teran talk about testing, because I'm not the medical professional. I do lunch. So as far as lunch is concerned, In the elementary settings, what we will do is students will eat in their classrooms with their teachers, and there will be an alternating, the teachers will still have their 40-minute duty-free lunch period, but what we will schedule that so that teachers have the opportunity to be in the classrooms with their students while they're eating their lunches. And then, of course, those students will transition to outside opportunities to be able to have their recess and those kinds of things. When you move into the secondary area, a lot of times in secondary, you'll see buffets or lots of opportunities for kids to choose different options for lunch. We will no longer do any of those kinds of things. What will happen is, as our high school students will stagger their lunches, and we will have more lunch periods so that we'll reduce the amounts of students that are eating lunch at the same time. Students will come in, they will already be prepared for them. They will pick up their lunches, and then they will have designated spaces throughout the entire building where students will be assigned to eat, again, in their pods with their same groups, making sure that we're able to do that contract tracing if something happens, but we make sure that kids stay together, and that's how we will conduct our lunch periods for our students.
Thank you. Kimber, do you want to jump in with the testing question?
Yes, as far as testing staff members, we are not set up to perform testing at this time. When we have been communicating with the health department on that to get their guidance, do they think that we should be testing people, staff members? The guidance that we were given is that no, that we would refer them to the health department to be tested. So we don't have testing set up at this time for staff members within the school district, to test there. Yes.
We also have a line 211, also for United Way, is also a free opportunity for our families to also take advantage of that testing there.
And I'll hop in on testing too. When it comes to one of the big picture things that we're trying to do, and as the school district we're trying to do, is drastically limit the number of close contacts for each student during their school day. And so a close contact is within 6 feet for 10 minutes at a time. And if you do traditional school, we all have been through school and know that there would be many close contacts in that realm. But if we can do things like mask, wash hands, physically distance, and cohort our kids, then you're drastically reducing the number of close contacts that is needed for the contact tracing if somebody does test positive eventually. When it comes to testing kids and teachers and medical personnel, it's very nuanced too, where a lot of times it's the health department needs to get involved, or the primary physician of that kid or teacher. And it's not comfortable to get tested, and the tests don't always give us the best results. And since the beginning of this pandemic, we've had limited testing availability. So it's going to have to be a discussion in most cases, and most medical professionals who aren't working in the ICUs directly doing those aerosol generating procedures aren't getting tested, or maybe haven't even been tested throughout this whole pandemic.
Dr. Muma, some of this brings up questions for me at the university level. How much testing, will the temperature be taken? How often? Those sorts of questions. And will there be choice? As with K through 12, parents have these choices that will be coming to them. How flexible is it, and how many logistical additions are there that you guys are going to be initiating?
Well, obviously, students have choice of what courses they enroll in and how they move through their curriculum. And we have building a lot of flexibility with our faculty in building their courses, because some faculty are concerned about their own health and they have risk factors and those sorts of things where they may not be able to come back to campus. And so we've given them a lot of flexibility to either offer in-person, hybrid, or online. And we've communicated that to the students, so the students can go out on the website and see how their courses are going to be offered.
But those have been the teacher's choice, how they would construct those?
Basically about 13% of our classes this fall will be online, and the other 87% will be hybrid, which will be a mix between in-person, online, face-to-face, through Zoom and those sorts of things. And in terms of other options the students have, obviously they can choose to do one of those kind of courses. They can choose not to do that. And the faculty, as I've outlined also. In terms of masks and washing hands and those sorts of things, we're going to have a similar sort of process that Dr. Hopkins outlined. We are not going to do that assessment ourselves. We're going to put that back on the students, and we're developing an app that they would check, and not just students, employees as well, every morning, to common questions that they need to be aware of in terms of COVID-19. In terms of testing, we have decided that we're not going to do mass testing of all of our students and employees. That's point-in-time testing, so it just tells you where you are right then. You're going to have to build in some other processes to continue to test if you start out that way. So our testing plan that we're still working on essentially is testing symptomatic students, those that are living in our housing, athletes, potentially asymptomatic testing for our students who are in healthcare fields, and they need to be able to show their status before they go out into the clinical setting. We're not requiring it at this point. In terms of testing, it's cost prohibitive for many of our students and also the university. We are working on potentially setting up a lab in the community where we can do more testing and help not just our campus, but USD 259, other industry partners, community partners that we work with, because we obviously know that there's not enough testing available, particularly affordable testing. So we are working with several folks on the possibility of doing that. And if that works out, then it may be that we would test more of the asymptomatic individuals on our campus and our employees.
Would you say for a student who wanted to take general lower level classes that they would, for the most part, have a choice because there are multiple classes offered each semester? If they would like to keep it all to virtual, it would be relatively easy for them to do that? Or
yeah, I think easy is sort of a loaded word, but so there's lots of options. There are some classes that are only offered, once per semester. So in those cases, there's less flexibility there. But that's not as common as what you're asking. So I think so for the most part. Again, as I mentioned earlier, 87% of our courses are going to be offered in a hybrid format. So that lends itself to a lot of flexibility. And many of the faculty that I've talked to are understanding that we're going to probably have to pivot again in the semester and probably in the spring. And so they're building their courses already to allow for that. And we're letting students know that ahead of time.
Stephen, how much funding is the state of Kansas providing to help schools, and how much has come from federal aid?
Well, a lot of it has been federal dollars. When the initial CARES Act passed, it was $230 million that went to Kansas education. That's around $90 million for K through 12 and $115 million for higher ed, as well as $26 million for the governor's emergency education relief grant. So she has some flexibility with how she used those. There's also some money, I believe about $1 billion that Kansas distributed from those funds, just from like general CARES Act funds to counties. So I've heard from different school districts as they're looking for ways to pay for the different supplies they're getting, from hand sanitizers to masks to thermometers, that they're looking to their counties to see if they could get some funding from that. But I think for many districts, there's going to be little way of avoiding having to just dip into their general fund. I don't think doesn't look like there's enough federal funding being provided to fully cover everything, as I imagine a lot of the educators here would agree that I know certainly on the higher education side, they were asking for significantly more money than was provided by the initial CARES Act. And that being, again, CARES Act being the federal, that first wave kind of like stimulus from the federal government. There's another wave being discussed right now of more stimulus funding. It's currently being discussed in Washington, but that's being tied up pretty tightly. There's a lot of fighting, particularly within the Republican Party itself, let alone disagreements between Republicans and Democrats on this. So what a final bill will look like, what it will actually look like for education, we're still probably pretty far off from that.
So if that does not materialize, if there is not more funding coming down, is this for Dr. Thompson and Dr. Muma, is this a big dip into the general fund for each of you guys, or is it just like a manageable, how are we doing with those things? Will you all be able to do all of the plans that you've envisioned?
Alicia, do you want to go first?
Well, we will definitely not be able to do everything that we would want to do. That's just with anything at this, But what I will tell you is that the new mandate that was given to us as it relates to the thermometers, I mean, it just seemed like every time we get our plans together, we think we're ready to go. Of course, we've had to dip into our general fund. I mean, as you all know, we've spent the majority of our CARES money that we did receive because we had a huge digital divide within our school district. And so we had to spend, of course, we got 17. We spent 24 of it, which doesn't match up with adding. We had to spend some of our own money to be able to purchase the technology so that if we had to go out again, our students would not be left behind. And that's not even including the $7 million that is going to be required to have. It's the one thing to get the device, but if you don't have access to the Wi-Fi, then you cannot you still have a divide. So we still have to spend $7 million of our dollars to be able to have access to be able to connect and to engage. So there is another again, as you can see, it's over the 17 that we received, and we still have not talked about all of the PPE that is needed to be able to, and the cleaning supplies and the extra personnel now that we're going to need to be able to do the temperature checks. And so it just continues to pile on and on and on with every decision that people make. It sounds great and it's wonderful to do, but every time they open the mouth, it costs money. And so that becomes our issue as it relates to that. So definitely the funding was there for a small portion of it, but as you can see, it's gone, it's depleted, and we have to continue to look for creative ways with our county, as he stated before. Now we're looking for our city. We've written grants. We've done everything that we could think of to be able to generate funds to be able to support our efforts to open school back up safely.
And I'll just add, for higher education, we received about, well, let me just point out, there's no general fund to dip into.
There you go. There it is right there.
For higher education, public education, they provide about 22% of our entire budget. The large portion of it is tuition, and then research and foundation. So there's no flexibility there. We did receive about $8.5 million from the CARES Act. Half of it was required to go to students to help them financially, which was definitely necessary. The other half is there's a lot of restrictions on how we can use it. We can reimburse ourselves from housing refunds that we had to make, which is about $2.6 million. So you can see that this money's kind of dwindled. We can use it for technology upgrades, and we're doing that. But we can't use it just for general expenses that we would need to continue to operate the university. So for us, it's cutting. And we did that for this current fiscal year that just started July 1st. We did a across the board cut We held back purchases, capital improvements, travel, other kinds of things, and that's what we'll have to do going forward. There is a request, or we're working on a request with the Board of Regents to get some of that CARES Act money or I think they're calling it Sparks money, to help us with testing as we go forward. But again, there's not a lot of extra resources, and we did get some additional money already, but the money that we received, they took it out of our general fund, so it was a swap, and there was no extra money that we received, and the money that they took out will be a permanent cut going forward in the next fiscal year. So it's challenging of how we're going to make this work going forward.
Sounds very challenging, just across the board. If you've just joined us, I'm Sarah Jane Crespo, and this is Digital Democracy on Tap. We're talking about getting back to school safely. Please join the conversation. We'll try to get to everyone's questions by the end of the hour. On that note, I'd like to get to some audience questions. An email from Sherry asks, will recommendations for all students to wear masks be implemented? And we talked about that a little bit, but what is the age at the bottom where, the youngest age where students will be required to wear the masks?
5.
Okay, so it's all of them then.
Yes.
All right.
Yeah.
Is that, Dr. Teran, do you think, this is what I guess what it has to be. Is this a good idea, from your standpoint?
I think as safe as we can be at this time is good. And when we think about lower transmission in the younger kids, those younger elementary school kids, we have to balance that with the fact that a lot of them aren't developmentally able to wear a mask, as it's a new habit for them that needs to be trained and practiced. And even in other countries, we get poor compliance with masks in those younger kids, and you might have increased high-risk face touches. But so when we hear this coming from our state government and from our school leaders, I think now's the time to get on board as parents. And I have a 6-year-old, and it's tough for her to tolerate a mask for long, but for the next, and I'm a proud parent in Wichita Public Schools, for the next kind of month or so, we're going to be kind of practice masking and find ways to make it fun for her and get her comfortable with it, because if it's what we need to do, then we're going to do it.
Make it a game.
Yeah.
Yeah.
Pick out
That's
the
a good idea.
things that she likes, things like that.
The other thing that is going to happen for our little people we're going to be doing some cool videos, do some training. So we teach the elbow bumping instead of the hug. We teach them how to appropriately take off their masks when they get ready to eat, to cough when you have to cough, how to cough. And we'll do really cool videos to be able to transition, washing your hands and singing songs and all of those cool things that we do as educators to be able to get our kids to be able to start practicing the hygiene and all of those things that Dr. Teran has taught us to do.
And we'll be doing that at the university too. It's still required to model social behavior kinds of changes. So peer-to-peer kinds of activities is what we'll be doing.
And I think adding on to that, the best thing is role modeling. So if we're not wearing a mask, but then we expect our young kids to wear a mask, then that makes it pretty tough to have them do it without being fearful. So when they see that our community is wearing masks and we're all working together to decrease the viral transmission, then it's less of a scary thing and more typical behavior, and most kids can work to do it.
And Sarah, I just wanted to add that I know some people, adults and children alike, sometimes wearing the mask, a lot of people say, well, it's due to my asthma or a breathing issue, but a lot of doctors and mental health experts have said it's more of an anxiety issue of having something on your face. So not only will we have the videos to teach our adults so they can model to all students, but also we have resources that I shared with our board for Wichita Public Schools about how to condition your children or to condition yourself. Like Dr. Teran mentioned, that they're not going to wait till the night before we go to school and say, okay, this is the mask you're going to wear tomorrow. To try it on when you're not out anywhere, when just watching TV maybe, just so they can get used to what that feels like and adjusting it. And so we're going to start pushing out a lot of resources. And also, I know that the county is getting ready to push out a lot of public service announcements with the same kind of information. So I think that'll be great.
Katrina from Facebook asks, is there going to be funding for schools to hire more nurses? Many districts don't have school nurses, let alone a nurse in every building. Of course, we're talking about that money not being there. How will you cope with the need for more nurses? Kimber, you want to kick that off?
I'm going to kick that to Dr. Thompson because I don't control the fund of the whole district, and I didn't know
she was going to do that.
Yeah, I'm sending you a hug.
Yes. Well, actually, honestly, we have begun to look at what our staffing model looks like for our nurses. We were feeling pretty comfortable when we didn't have these temperature checks at all of our sites. And now that we have some additional responsibilities with that, as you heard me say before, that is going to be a people business. And we would definitely be depending on our health folks in our buildings to be able to help us with that. And if they're not there, then they can't help. So that is definitely something that we will have to be able to look into, especially with the new added temperature checks.
Let me get to a couple more. We just have so many questions from folks here. Tyler, also on Facebook, asks if the start date is pushed back, will the start date for first-year teachers also be pushed back?
Well, it just depends on when we start professional development, because what we do understand is even if the start date is pushed back, that the start date for teachers will look different than the start date for the students. So we are waiting a little bit more for some additional guidance from KSDE, regardless one way or the other, about the start timing and those kinds of things. We'll wait for that. But those people that are doing the student teaching, I hope that person that's out there is looking for a job. We'll be hiring soon, so make sure you stay in the Wichita Public Schools. But what we will do is we will bring all of our teachers back around the same, and the student teachers and things of that nature will come back as appropriate with our teachers.
Another Facebook question, if Wichita ICUs run out of beds, would that impact students attending in-person classes? Dr. Muma and Dr. Thompson, would you both weigh in on that? If it's just going out of control here in the Wichita area, what would that change for you guys?
Well, for us, as I said earlier, we have planned to be able to pivot if we get a stay-at-home order. And I think that's what you're getting at, if things just really got out of hand. And so we've already told our faculty that you need to plan in such a way that you may need to do that. It may be inevitable between now and the end of the year or even next year. So for us, it won't change the way we're calendared currently for the semester. It will change some things of delivery, but hopefully we've planned enough to prevent as many disruptions as possible. But it's not going to be perfect. We'll have to do what we can to make sure it goes as smoothly as possible.
And we are ditto, as Dr. Muma said. We definitely also will be taking guidance from our health officials, our county health officials. We would be working with them to determine and keep track of what is happening with the virus within our community. And then depending upon where we are with those numbers, again, our school district is ready to pivot. We have options, but we're also ready to be able to bunker down at home if we need to do that as well.
Stephan, what have you found out about training teachers might receive to deal with this crisis in the fall and beyond, online training or in the classroom? I know you did a report on that. Oh, you're muted.
Yeah, sorry.
A lot of that was focused on kind of the summer prep period, and there's a lot of really great options for teachers that want to on their own do some training to prepare for what online might look like, and groups like Greenbush, the Education Center, they provide these online trainings. Part of the challenge is, though, that there's not much in the way of mandatory trainings provided by districts, and that's somewhat understandable because there are teacher contracts. They cannot require these teachers to be doing this training online. They can't require them to become early without renegotiating aspects of their contracts. So what that means is then, as Alicia Thompson had referenced, that period before school starts, before students come in, there is a period where teachers come in and they kind of like an orientation. Every year they get, there's certain required trainings that they have during that time, such as sexual harassment training. They'll also during that time, for many districts, get some sort of training on both in person for when sanitizing their classrooms, training on how to do that. Also training on how just to do like different hybrid models. But that is a lot of stuff to cram into a small period of time, and it's not like school districts are then going to stop once that period is done and then all right, teachers are off on your own. There will be more training, but it just part of the way our system is that we had a decent stretch to build up, and we haven't been able to take advantage to get all teachers well trained. Again, a lot of teachers are on their own doing this training and learning a lot about how to do this, but I think we all saw in the spring how challenging this is. So I think there is a lot of concern about teachers being prepared for what more both distance learning and learning with these types of restrictions, what that's going to look like. And Alicia Thompson, I'd be curious to hear from you. Last I heard from the district was they were waiting for the state guidelines and then Wichita's plans to say what their professional development, what your professional development would look like, what your training for teachers would look like. Curious, has that changed, or what are the current thoughts on that?
Well, as you know, we will pivot as soon as we hear exactly what the plan is going to be from KSDE. As you know, they're meeting in the morning at 10 o'clock a.m. And then as it already has been published, we will be meeting on the following day, which is Thursday at noon. At that time, we will talk a little bit about what we think that could look like so that teachers can have the opportunity to know a little bit more about what could potentially happen. But again, we don't know what they're going to say. We get less than 24 hours and then we're standing in front of folks. It's not going to be as thorough and in-depth as we would want it to be, but we're definitely going to share what we know and be able to give a little bit of what we anticipated it looking like for teachers when they return back, and potentially even hopefully because again, our contract is negotiated for teachers. So we can't just go around changing their calendars without meeting with teachers and our SEIU, which is the right thing to do. But we have not had opportunities to be able to process and dialogue with them. So we can't make any of those types of announcements until we've had the opportunity to properly vet that through our teacher union and our SEIU, and we have a security union as well. So we have to do that, and I think that's, again, the right thing. So it'll take us a little bit more time to get in there and to learn everything that we need to learn and then get with the appropriate folks at that time. Because we have to have definitely 1,116 minutes of seat time. And so because we have hours of seat time, and so because we have that certain amount of time, we have to keep that in mind and then build upon the teacher's contract, days off, conference release days, and all those kinds of things. And so it's very complex, but the magic number is 1,116 minutes of seat time. And that is critical for us because that is definitely something that they did not take away, even though we start school later. We still have to have that contact time.
Let me get through a couple more questions that have been coming through here. Michael on Facebook asks, how do you envision maintaining inclusion for students with special needs?
Well, again, the IEPs are there. And we will definitely continue to follow what is on the IEPs as we did in the as we would do any other time. So that does not change for us, the minutes and the requirements that are on our individualized plans of studies for our kids.
Jeffrey asks, how will band and choir students be affected by these changes? Let's not even talk about sports. I mean, what are we going to do?
We definitely, there are, actually, we have on our website, when we release that, it will be open. You will be able to see exactly specifically what band will look like, what choir will look like, because as our medical professionals tell us, those are pretty hard things to do in a school setting. So there will be alternative ways in which you can do music and band that looks a little different than what we've done in the past. And we have teams of professionals in those areas and associations who have worked diligently to create those plans, and they are available, will be available on our website once we get that opened up.
And when did you say that will be put out there?
Well, it will be opened up next week, around next week, sometime next week.
Okay.
Once we kind of get all the rules in place. Hopefully they don't change again. But if they do, that's okay, because our new middle name is Pivot. So we will be able to pivot again if we need to, but we'll put those out there sometime next week so that everybody can see the full plan and also any specific specials areas that they're interested in.
Can you all talk a little bit more about how to protect the teachers at every level, how to protect adults? I mean, not to mention the parents of the children that are coming home to them, perhaps, you know, going to cough on their mom and dads. What are you all doing for the adults who are perhaps uneasy about risks?
Well, and I've mentioned this already, we are requiring everybody to wear a mask. You know, that there's that ordinance now in the county and the city that protects us from other people when we require masks. Hand washing, we have obviously signage to encourage that, but also we have a cycle of how classrooms and high-touch places will be cleaned on a regular basis by our physical plant employees. We've installed, the number slips me right now, but hundreds and hundreds of plexiglass barriers in high traffic areas, even my office, across the campus. We will have, for people who don't have a mask themselves, we'll have stations located across the campus where they can get those if they forget it or don't have one. And then we're allowing our employees who have a special concern about their own health or concern about one of their family members that they don't want to potentially affect through this, to work with our human resources department to allow them different ways of working and protecting themselves. So those are the main ways, and I think that we'll learn as we go when everybody starts coming back in August, what additional things that we need to do.
Dr. Thompson, anything additionally you would add that you haven't?
Very much ditto. I mean, all of those same precautions and rules and accommodations for teachers and all other staff that need that is being put in place as well. So very nice job, Dr. Muma, that you're doing the exact same thing.
And I would like to
go ahead.
I'd like to credit the school leaders and Dr. Thompson. They're putting a lot of just new procedures and operations. And when you see it that we're doing so many different things with different cohorts, different masking, hand hygiene, and screening, we're hopefully going to get to that point where being within the school setting is kind of like within the hospital setting, which generally I feel safe most days when I go into the hospital. And so the success of school reopening is going to be directly dependent on the community burden and the community spread at that time. So the way we can all as a community protect those teachers and protect those students is do those public health efforts that we've heard for the past few months and get our community burden down. Because with all of these kind of new operations in place, it'll probably get to the point that it's safer within the school setting with all of these operations in place than being out and about in the community, being at the grocery store, being within your own kind of household, who may have been exposed in a lot of different locations.
I'm going to add another little piece here that I have not brought up is our HVAC initiatives. You know, one of the things we've learned from Dr. Teran and teams is about kind of the circulation of the kind of air and fresh air coming in and fresh air going out. And I didn't want to talk too much about it because I'm really not the expert in it. But what I can tell you is that we're definitely modifying the outside air dampers to allow for greater minimal settings. We were approximately about 10% of that happening in our school district. We're going to bump it up to about 20 to 25% during the time when we're being occupied inside of our building. So we will be getting that fresh air in and working on ways to, of course, control all the humidity and all those kinds of things. And that is a very expensive thing to do, but we do know that it will make a difference and in our building. So that's one initiative. The other piece that I think is interesting for us is we're going to be doing bottle fillers. We're changing all of our drinking fountains out, and we're replacing them with water bottle fillers. So our new school supplies will be water bottles. So parents, if you're out there listening, we need water bottles. And if you want to donate water bottles, we'll take those too, because we will be utilizing water bottles instead of our drinking fountains, which I think is pretty cool. And one of the other things is the hand sanitizer. One thing I learned about that is it has to be, the CDC recommends that it's a minimum of 60% alcohol, I guess, in your hand sanitizer. So we have 75% in our hand sanitizer. So it's pretty good stuff. Making sure that everything is to the levels that they need to be in order to make sure that it is fighting it. We have some, it's kind of cool. There's these little sprayers that people will be using with a medical grade kind of solution inside of it that will be disinfecting our classrooms, kind of what you use at the airports. Those things will be done in our buildings. The restrooms will be clean a certain time. We'll have things on the walls to say this bathroom was clean at this time, and so on and so forth. So it's really going to be high tech, and it's a lot of enhancing things that will be happening in our spaces with our children and the adults, because you ask about the adults, and that's very important to be able to protect both of our teachers and our students.
And will the HVAC updates and the water bottle fillers, are those going to be ready when school starts, or is this a longer process?
Nope. They've come in, and we'll have them all around the school. We will have, all schools will have access to them all around. And then as the more come in, eventually all of them by the end will have them all replaced. And that's just good practice, probably forever and ever, as we are learning from our health professions. This has kind of been cool to have your health professionals and educators working together, because we are really learning a lot about each other's role and how really we should have been working like this hand in hand a long time ago. So this has been an awesome opportunity to learn and to grow and to become more cohesive with each other.
Silver lining.
Sarah, I just want to add, Dr. Thompson, you did a great job talking about all of those systems that we're putting in place. One other thing, just to ease the mind of staff members, we have a lot of staff that work with special needs students or work with kids where they're providing services that they're going to be in that bubble within 6 feet. You know, if we have a student with a G-tube or, you know, a trach, or we're helping a student with diabetic care. So, you know, our people that are our paras or our teachers or health room workers, like our nurses, health room assistants, and delegated staff, we will have additional PPE for them besides just the face mask. You know, if of course, we've always had gloves, right, when we're doing those personal hygiene type of things, but face masks and gowns for those situations with transfers and things like that. So that's another added protection for staff as well as students. And the other protective measure that we have in place is for health, mental health. a great thing about Wichita Public Schools working there is we have the employee assistance program for our staff, because anxiety is high right now because just the unknown, and that's normal. But so we really have encouraged our staff, our employees, to reach out and take advantage of that. And then we will be providing all kinds of mental health services and resources for our families too. And we do work directly with our community mental health providers and have connections with them. So that's going to continue so that we can meet those mental health needs.
We are at 6 o'clock already, but I want to get to 2 more audience questions real fast. I think one of them will be quick anyway. But this one segues nicely out of what you were just talking about, Kimber. How will these restrictions and changes influence students emotionally and socially? And is there an age group that will be hit harder in this respect? Is there some group that we're looking out for a little bit more?
Well, just quickly, we're going to be doing a social and emotional assessment this year. There's something new. So all of our students will be assessed so that we know where they are. We actually have a lot of support from the community that will also be joining hands with us in this event to come back to school and be able to support our students differently. So we got a lot of things going in place for that. And the assessment is the first tool to find out where our kids are.
Okay. Now this, a quick one here from Patricia. If parents have registered for a remote or in-person option, how easy will it be to switch between these options? How many parents are delaying registrations? Not sure which option to lock in yet.
We have a lot of them that are delaying. And so I'm going to put a plug out, please enroll. But if you want to be more, I know everybody wants to know which one we're going to do. So on tomorrow, Thursday, when we meet at our Thursday meeting at noon, we'll have some more conversations and get closer to making sure that we have what we're going to be doing. Again, that's contingent upon where we are in our community with the virus. So I will make that clear. There's still an option for full remote out if need be, depending upon where our community is. But those 3 options that we have put forth, hopefully we will get some direction from our board on where we want to go with those options. Families can enroll in those 3 options. If they choose very small window of time, you get into it, you don't like it, then you get the option to be able to switch out. But then once you get in and we lock that time in, then you will be there for the semester because of staffing. Mm-hmm. So we will give you a chance to, so that's why I say enroll, pick one now. You still have a chance to change your mind. But then once we lock that, then you're in. So just enroll and pick one, and then you can change down the road. But then we lock.
Then you're locked.
Yeah.
Okay. Very good. Last question from me tonight, Dr. Teran. I wonder if you would kick this one off. What can parents do to help their children's return to school be the safest possible, and what can everyone else do to help support safe back to school efforts for the entire community, not just parents?
Yeah, I think the good thing about kids, and one of the reasons I like being a pediatrician, is that kids are resilient and they can handle a lot of pivoting. But at the same time, it would be cause a lot of harm if we aren't able to open up our schools in person sometime soon. So for parents, the way we work with our kids is to be honest with them, spend a lot of time listening and kind of hearing those themes that they're thinking about, because they know, they hear what my wife and I say to each other at the dinner table. They hear the news in the background. They know that there's big decisions being made. And so listen to what they say, hear those themes and talk to them about it. And for our community, it's about doing it for the kids at this time, not doing non-essential public activities, wearing a mask, washing your hands, keeping it focused that we want to protect our great teachers and our students, and make it so that they don't have to face the harm of missing a lot of school.
Sarah, could I add that I think something that parents can help us out with is we still need kids to get their annual well child visit and their immunizations up to date. Because I know our nurses sent those letters out by May 15th, which is mandated by law, but we need them to get out and get their immunizations because we don't want to have other concerns come up with other communicable diseases because we aren't immunized. And my understanding is that the providers have safe areas that you can come in and get those services at your pediatrician, your healthcare provider, a local community clinic. Please get that done so that we can have an even more safe and healthy return to school.
Yes, all primary care offices are doing immunizations, and our rate at the beginning for the state of Kansas at the beginning of the year, at the beginning of the pandemic, was very poor. And so now we need to catch those up. So we aren't primed for measles, a whooping cough, other types of outbreaks. And when the flu immunization comes around this year, this is the year to get it and to work together so that we don't overwhelm the hospitals this winter.
Get your flu
Sure, I'll just add too, because Paul just talked about this is for the kids. We don't call our students at Wichita State kids, but these were your students in K through 12. And many of them are making a transition from K through 12 to Wichita State and other universities. And we want them to be able to do that. But also many of them have made lots of investments to get to college. We don't want those to be lost either. So we're all in this together.
Yes.
Very good. Well, that is all we have time for tonight. Thanks again so much to this wonderful panel for joining us today. And thanks to all of you for being with us. Until next time, check out engageict.org for past videos, podcasts, and more. I'm Sarah Jane Crespo. Thanks for joining me for Digital Democracy on Tap, and good night.